Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Welcome to today's episode. We are discussing conformation and posture today. How are you going, Sophie?
Hi, Raquel. Very well. This is a very interesting topic because, once again, like most episodes, it does relate to every horse. And it's also something that lots of people might not have thought about. You know, it's not quite as common as some of the other discussions that you see floating around social media and other places. And we hope to articulate it in a way that's easy to understand and gives people some insight.
Yeah, and I think also the terms conformation and posture can be a little bit confusing because some things that are referred to as postural, may be conformational, other things that are referred to as conformational, maybe postural. So that it can be kind of, there can be a bit of confusion there sometimes. And I'm not claiming that we're going to have it all clear for you because I think there is some gray areas. And I would have said when I was a vet, like just a vet, that it wasn't grey at all. That I would have said certain things that I now see as postural as being conformational because I was like, you can't change that. And we're going to talk about, the difference between what is conformation versus posture. But then when I started doing body work, I saw things change that I was like, oh, wow. Would not have expected that to change. Didn't think it was possible for that to change. And it really made me think about it very differently. So, first of all, when we think about, well, why is it actually valuable to people to understand the difference between conformation and posture? Like, why would you say it's valuable for horse owners or professionals to understand the difference?
It's important to understand the difference because people have different goals and different expectations about what their workload, their journey is going to look like with their horse. That might include the discipline that they're involved in. So, the difference between the reining sport as opposed to a jumping sport, you're looking for different movements and therefore you're looking for structures in the horse that can handle different loads or move in different ways, have different, muscle and bone structures to support the best, possible performance that you can get from that horse. And of course, you might be limited in your abilities with a certain horse if you're hoping to go, maybe to a higher level in a sport. So your expectations for horses and conformation as opposed to posture is really important.
Yeah, definitely. I think it gives you a bit more realistic kind of view on your expectations. But also I've seen some pretty poor conformation performing at high levels. So if you understand your horse's conformation and posture, you can also understand how you can support it. Where your horse may need extra strengthening compared to other horses, or where they might need more stability or more range of motion, or where you might have to focus more on certain things. Like, for example, if a horse doesn't have a great conformation for landing over a jump, for example, so you don't want to land on those legs too many times. You want to limit that. Then you might not train jumping for your jumping horse. And we're going to do an episode on the importance of variation in training, which kind of ties in with that. But you might train other ways to help your horse in the jumping, but to minimize the stress through, you know, their structures, which is a weakness in their conformation, for example. So it's, yeah, very, very beneficial for you. And like you said, different disciplines have very different requirements for things like lifting the legs, motion in the legs, you know, whether that's like your high level dressage where you're looking at big lateral movement. So you want to be able to, you know, move the limb across the body. So a longer bone length in the limbs can be beneficial, especially in the humerus. Or you want shorter kind of bones to lift them up over a jump, or you want, you know, a bone structure that's going to help you come to a sliding stop in Western disciplines, or you want a horse that's able to do everything in eventing or working equitation, where you want them to, you know, to be flexible and strong and compact all at the same time. So that makes it really valuable. So when we think about conformation, how, you know, what do we think about when we discuss conformation?
So thinking about conformation, these are things that are generally not altered in a horse. So that might include, will include bone structure. So that relates to the length and the angles of the bones. These have to do with, you know, the length and size, the width of a bone, whether a horse has, you know, larger bones than another one, and that might have to do with, you know, breed, size, etc. What other things are you thinking of when you talk about conformation?
Yeah, I think the length of the bones can be really important. Now, obviously, they do lengthen as a horse grows, but you know, if you look at different breeds, we see different different. And when I guess we're talking about bone length, we're talking about it relative to the size of the horse. So for example, like you'll look at a warm blood, they often have longer levers, longer bones, longer humerus, longer femur, as opposed to a quarter horse, which will have shorter bones. So yes, there's a difference in size of those two horses, but there's also a difference in the ratio of the bone length relative to their size. And then you'll have things within a breed, you know, so there just might be some horses like Ellie Mae's a thoroughbred warm blood, but she has quite long pasterns relative to the rest of her bone structure. So you can get things like that where they have really long cannon bones relative to the rest of their structure. And so that's setting up that if you want a horse to do miles, you want those tendons to be protected. So you might not want a long cannon bone. So, and it's generally not altered. So conformation is usually the bone structure that that horse has, and the ratios to the relative to the rest of their body. And we'll see such things as like just indifference of breed. So like we know that we have different breeds such as Clydesdales, and they look very different to a quarter horse and very different to a Friesian and very different to a mini. You know, they have very different conformation, like their bone structures, their bone sizes, their bone ratios, even their joint angles relative to that breed can be very different. You know, like we see the Clydesdales generally are a bit more like with their hocks pointed inwards, cow-hocked. And that's a conformational variability for that breed because they're designed to pull, as opposed to the quarter horse, which over time the breeding has changed and they've become very upright in those hind legs. And so that has become a conformational trait of quarter horses. And so I guess the other aspect that we talked about there is how humans have intervened and altered conformation in a lot of breeds too. What other kind of aspects apart from breed would be considered conformational?
So that has to do with individual things in a horse. So that might be, and so you can have breeds that have a predisposition towards certain changes in the skeleton, so that they happen on an individual. So for an individual, horses can have a variable number of lumbar and sacrum bones. So the lumbar
And
generally
thoracic.
has, and thoracic.
Yeah.
The the horse usually has 6 lumbar and 5 sacrum, but in dissection, it's been found that some horses can have, say, 5 lumbar vertebra. And so that's a variation in an individual away from the normal. And in some breeds, it's more common than in others. So you can also have a variation in the bone structure itself. So where the individual bone, it's not that there's more or less of them, that the bone itself is different. So one example of that is a transitional rib. That's where the last rib on the horse isn't articulated, so it doesn't have a joint in between the vertebra and the rib. It's just a solid structure. And sometimes there's, the side of one lumbar vertebra, the first one has become a rib, or in the last thoracic vertebra, so the thoracic vertebra have ribs off them. The last one on one side, there isn't a rib. So there's lots of variation with those. You can also have ECVM, which is the cervical vertebra of the C6 and 7. The processes can be different. There's hip dysplasia in, some breeds due to the shape of the bone themselves. There's also hemivertebra. Could you expand on the hemivertebra?
Yeah, so a hemivertebrae is like half a vertebrae, so it could be in the lumbar spine, for example. And so instead of having a full vertebrae with the transverse processes on each side, it's just like the body of the vertebrae, and that could be a different size or shape to a normal vertebral body. And these things are not always obvious externally on the horse. Like the fact that a horse has a hemivertebrae might not ever be picked up unless the horse is dissected. In a dog, we can x-ray the whole dog, and there's certain breeds in dogs that are like bulldogs, I think, that are predisposed to hemivertebrae. But we can x-ray the whole dog and go, oh, look, there's that weird vertebrae. Hip dysplasia, I'd just like to add, so that is often in minis. And so I dissected one last year, which had quite severe hip dysplasia, where the socket that the hip sits into was extremely shallow. And so, the hip wasn't really sitting in. And I can see these ponies, like the way they walk, they often are quite angular in their hind legs. Like the hind legs will generally turn out quite a lot, and they look a little bit like their pelvis gets a bit stuck in flexion, and they look a bit uncomfortable over time. And so yeah, they're little horses, not always minis, but small horses can be predisposed to hip dysplasia. And the other thing I'd just like to go back and add too with the number of bones. So you talked about the lumbar vertebrae and how, there can be 5 or 6. There can also be a difference in the thoracic in terms of number. So like it can be anywhere from 15 to 18, like thoracic vertebrae. And so that's just going to change, the way that horse's back can work. The other aspect that can change within that is the angle of the spinous processes and the shape of the vertebrae. So you might have 2 horses that both have, for example, 18 thoracic, right? But one horse has 18 thoracic and the vertebral bodies are quite long. And then the other one has 18 thoracic and the vertebral bodies are quite short. Or, one has longer spinous processes that are more kind of upright and closer together, so a short backed horse, as opposed to maybe a longer backed horse or a horse that's, sometimes we're going a little bit into posture here, but it's probably more the length of the spinous processes can be altered and the vertebral bodies. And the other thing with the sacrum is, and again, this has probably become conformational. So things can become conformational, like if a bone fuses or changes in a way that it's now a different shape. So for example, if a tail vertebrae fuses to a sacral vertebrae, like you now have lost that joint between, like that joint now has changed. So the tail joint is now a little bit further down the tail where it joins onto the sacrum, as opposed to, you know, where it might have been initially. So there's a lot of things that, yeah, that in the, and when we do talk about conformation, it is bone structure, you know, it's it's really the way that the bones are designed within that horse that becomes quite conformational. What else would you like to add there?
Well, I think you touched on the fact that, you can have variability with the humerus and the femur length. So that's the bone that goes between the shoulder and the elbow and the bone that goes between the hip and the stifle. There can be a lot of variation there in individual horses, in breeds. You can also have things such as offset knees, and that can have an impact on the horse. Like you were saying, a horse that doesn't have fantastic knees, are you going to want to jump on those knees? They're going to be taking concussion and also seeing what other things that are popping up. And just circling back on what you said about the impact of human intervention, there's a genetic component always when it comes to conformation and thinking about how we're breeding for health, to support horses and be conscious about what our goals are for functional movement for the horses, and improving them for the next generation as well.
Yeah, really thinking about strength in that function, not just what you might perceive as being beneficial for the discipline. Like, you know, how are you promoting a better strength in the function of the individual horse, not just getting, say, more scope over a jump or more flexibility in a dressage horse, which we've seen as not leading to great outcomes for the horse in terms of hypermobility. So yeah, we have a big responsibility in terms of conformation. The other thing I'd like to add is that conformation, you know, so we view conformation as being set, and I touched on it before about that it can be changed. But if you have a foal, you know, that's born with a certain conformation, and we talked a bit about this in the foal, when we did the episode on foals, like we talked about how I've seen big changes in horses, in foals' bodies. But if we notice there's certain, you know, conformational challenges, if we can pick these up in younger horses, maybe the angles of the pelvis, maybe the what else? The neck length, the neck positioning relative to the body, the back, like, you know, the back, the way the back is looking, like we can change these. So the bones respond to what's called Wolff's law, and so they respond to loading. Sorry, they respond to loading, and it's called Wolff's law. But basically, younger bone has a quicker turnover, and so it can resorb and relay bone, and so it can change the bone structure quite a lot in growth, apart from the fact that they grow from their growth plates and they get bigger in that sense. But we can actually change structure. We can't change it if they've got an extra vertebrae or a, you know, a hemivertebrae or ECCVM or something like that, but we can change it if it's more like a positional conformational thing. So we can change that by feeding positions, we can change it by postural work, we can you know, influence with body work and nutrition and the hoof balance. So those things, you know, we do have quite a big chance in a young horse. And don't forget that they're growing up until some horses at least 8. Like I saw some bones from a horse the other day that had obviously been dissected. It was 8 and it still had open growth plates all through the spine. So they weren't fully fused as yet. And that horse hadn't been ridden. But it did have, unfortunately, some other issues, which was why it was put down. But it had quite a lot of arthritis. But yeah, we can really alter that. So when we think about posture, then what kind of thing, you know, how would we describe posture?
So if I was going to describe posture to someone, I would tell them about how it relates to the way a horse stands and the interaction of the soft tissues of the body with the bones and the way they are held in space. So it's very dynamic. We have other episodes on posture. It's very, it has a lot of movement. It changes a lot, and it can also change joint positions. So that might be the orientation or the position of the joint and how it's held based on, you know, how the horse is choosing to place their limbs, place their body. There's a lot to posture. And as you were saying earlier, it's a bit of a gray space because sometimes you can't tell what you were saying about the vertebra and the variation within them. It's hard to tell and to be very cut and dry. It's nearly impossible because you don't know what's going on underneath the surface. And there's so many internal and external environmental factors that we're about to go into. It sometimes it's difficult to tell whether or not something is conformational or postural, and that's why broadening your understanding of function, posture, and thinking about conformation when you're selecting horses is really valuable. And looking at foal, you know, and seeing a horse throughout their life, how they've looked as a foal, how they've looked as an adult, if you have access to those kinds of things, can be very informative as well. Do you have anything to say on how you would describe posture as opposed to conformation to people?
Yeah, I think it is very useful to look at the young horse. Like if you're buying an older horse and you can see some images of a younger version of that horse, it can be really beneficial. It gives you an idea of what the structure of that horse has been like. But you know, I saw a photo of Jelly as a 3-year-old. It's really interesting, and his neck was the same as, you know, when I got him at 13. However, his neck is now different. So his neck is now getting wider. It's taken a couple of years. Again, like it's not, I haven't changed that very quickly, but it's interesting to me because I saw the picture as a 3-year-old and then obviously I saw him as a 13-year-old, but I've still been able to have an impact on that. There's still underlying bone structure challenges for his neck, but by altering the position of his thoracic sling, I can influence the shape of his neck. So there are many internal environmental influences. So if we talk about the internal ones first and then the external ones, so what kind of things would we classify as internal influences on posture? So we're talking about within the horse.
So my first place to go would be, you know, the brain and the neurological system that's controlling one, how the horse interprets the environment and how they choose to position themselves for comfort, and also how that becomes an automatic pattern.
Yeah, and the movement patterns related to brain function. Yeah.
Yep. And I'd also be thinking about hoof balance. So thinking about what I can see in the hoof as how it relates to the body, and what I can see in the body and how it relates to the hoof. Evidence there, I'd be looking at musculoskeletal function. So the soft tissues, you know, there's lots of things you can look for, everything from symmetry and muscle balance, and understanding balance between groups of muscles that function together on one side of the body and comparing muscles from, say, the left to the right side of the body, looking for all sorts of things, tone, symmetry, things like that. They're gonna contribute, to the horse's posture. All of those things are determining the horse's posture because particularly the muscles, hold the body in a position. Stretching between different bones, they're altering joint. Every time a joint moves, muscles have activated in order to open and close a joint, and they happen in sequences, throughout the whole, they're isolated or they go throughout a whole limb. And so the muscle is really, really important to posture. What other things would you be?
Yeah, I think injuries have a big influence on posture. So even scars that horses have had from a very young age, like I had a client's horse recently who the scar had been there from when he was a foal, but he was now showing lameness and he's like 17, I think. And seen numerous vets for lameness, and they'd done nerve blocks and x-rays and things and nothing was showing up. The scar had been traumatized again, and so it was actually causing the lameness. And so, and it had changed his posture, and everything. And so sometimes old injuries can alter posture many years later, especially slip and sliding in the mud or, getting away from other horses, herd dynamics, things like that. So injuries are really important. Scars, muscle attachments to bone, whether there's any kind of trauma in those, we've talked about in theses sites, and how that's affecting the bone position. And then the other internal factor would be the metabolic status of the horse. So we see things like with Cushing's horses, you see they lose quite a lot of muscle. They get muscle atrophy. They get more of a dropped back posture. And so that can really alter their posture. Or, things like with Jelly, with his muscle disorder, his hind end, his hamstrings would get so very tight. And then how that impacts his pelvis motion and his hip motion. Like he has a lot of hip challenges, I think, because of the tension that he's held in his muscles. So those metabolic factors and metabolic health of the horse, like sometimes, they're just be horses with really tight muscles and you're like, or fascia, why is the fascia so tight? Why are the muscles so tight? And it could just be there's a slight nutritional imbalance, a slight buildup of an element in their nutrition. Like I remember years ago I had a horse that was hair tested, like mineral hair tested, and they found a buildup of arsenic in the hair. And so balancing out her diet, like I was treating her and I'm like, she's just not responding how I'd expect. She was a young horse. Young horses should respond very well, and she just wasn't responding. Anyway, once she got that hair test analyzed and then adapted the diet to allow for that, she was able to respond to the bodywork and her posture was able to change. And so the metabolic, and that comes into external factors because nutrition is obviously an external factor, but it's influencing the internal factors there. So is there anything else on internal or happy to jump to external?
Yeah, I think that covers most things. If you were then, talking about factors, external factors, environmental influences that, have an impact on posture, what would be your first thoughts?
I think the biggest one is stress. You see the horse that's really stressed and they often have that high head posture. They it can change their fascial tension, it can change their fascial health, it changes their hormonal, balance in the whole hypothalamus pituitary axis. So the way that, all the hormones are kind of working throughout their body. So stress has a big impact on posture. surfaces they're standing on, surfaces they're working on, the surface that they've got on their feet. So do they have boots? Do they have shoes? You know, they're going to have a big impact. And then training. So, you know, like how they're being trained. So are they, you know, is their head being held in a set position or put in a set position? Are they doing a lot of hard work? Are they doing the same work all the time? Are they always in the same positions and there's not any variability in that position? Are they strong enough? Those sorts of things. What else would you add to that?
I'd be thinking about tack that's being used. So I personally can relate to this very strongly. I just spent a week hiking with a backpack on, and even though I wasn't changing backpacks throughout the time, the way that I adjusted my backpack to sit on my back as I was going made a massive difference to my level of comfort. And I'm somewhat a newbie, so, you know, not understanding that more pressure on my lower back was making my pelvis ache, and then, you know, relieving my shoulders and then relieving my lower back, and how much I was moving myself to find comfort, being influenced by an external factor. So, you know, for horses, that includes saddle fit. Which includes surcingles. You know, for a roller, if you're using one for long reining, if you're utilizing a great tool like the Equiband, you know, considering what kind of roller you're using. It includes other things such as boots. It includes your bit and your bridle. How are they affecting the horse? You know, if your horse's bit doesn't fit, how are they going to alter the way that they use their tongue and the way that they move their head and where they hold it to help them adapt to the pressure that they're experiencing? Those are the main ones. Even breastplates. I think recently I saw a horse with a breastplate that didn't fit very well, and just taking it off made a huge difference to that horse's posture and the tension through the front end, and how they were leaning into something that was kind of uncomfortable, trying to find some relief there. So there's lots of different ways. Tack's a pretty big influence, you know, especially when we're sitting on our saddle. It's always important to consider your saddle. And then I'd be thinking about nutrition, which you said plays into the internal environment, but also the external environment, including, you know, is your horse getting enough forage? Are they chewing enough? The dental and TMJ balance that can be affected by the food that they're eating, because they're eating so much of the day, makes just a huge difference throughout the entire body. And of course, movement, which is a huge one. And just the fact that the way that you move reinforces patterns in the body. It does everything from condition the body. If you're training for fitness or a certain level of things, it has to do with the kinds of movement, whether that's jumping, or we're talking about reining horses, or you're a trail horse, or you're always doing the same thing. We'll have episodes on variability in training and for movement as well, but movement itself, movement can be medicine. It really can be for your posture. You have any other thoughts on movement and posture?
I think with movement too, it's the movement that they're just doing in the paddock. And our horses generally are very limited in the number of kilometers they will naturally do in their environment. And if you look at wild horses, like you see, generally they have a much different shape to their back than what a lot of our horses do. And they're just moving. And they're just moving, you know, over many kilometers in a day. And so, you know, I say to people, if you don't know what to do with your horse, just move it in some way, like just preferably without brace, you know, preferably in a way that the horse is not stressed and they're relaxed, but create some way of promoting movement, because I think that our horses are very limited with how much they can move. So yeah, that's a big external influence on posture. So if we're thinking of some examples that are, you know, more postural examples than conformational, I'd just like to add one before we kind of go into the ones that we're going to talk about. But one aspect that I had was when I got Mooney. I can't remember if I think I did talk about this in variable feeding positions, but you know, so he was over at the knee. So his knee was buckling forward. And so it ended up, you know, it was postural, and he had a massive pectoral tear, like a huge hole in his chest. And then through that altered feeding position, I was able to alter that posture. So that's an example of like a postural challenge that was alterable with appropriate environment. But yeah, that's not, it depends what the issue is. So what are some other examples that, you know, you would think about in terms of posture and the things that are potential underlying causes of those?
So I'd be looking at whether the horse was camped out or camped under. Sometimes those are considered conformational, particularly I think in horses, say, with a quarter horse influence. A lot of people think that the being camped under is conformational.
So that's with the back legs
With the back
more
legs.
their body, or camped out is with, so they can have it in their forelimbs or their hind limbs. So camped under, the limbs are more underneath the body, whether it's the forelimbs or the hind limbs. And then camped out is more, the limbs are further out away from the body, so in the hind limbs or the forelimbs. So yeah, we commonly see a camped under posture in quarter horses. Yep.
And do you want to talk about why you often see that those individual postural changes, say being camped under
Yeah, I mean, I think
posturally?
it's the work that they're doing in terms of the sudden stopping and turning, and that their psoas can become extremely contracted, as well as their, you know, lumbosacral joint may lose extension. Obviously, it comes back to hoof balance there as well. And I think camped out, again, lumbosacropelvic function if we're looking at hind legs, but camped out in front, as we talked about in a previous episode, like foot discomfort, laminitis, even camped under can be heel pain in front legs. So yeah, there are a couple of examples of camped out and camped under. We're going to talk about sway back, and sway back could be postural or conformational. So I've seen it in both circumstances, you know, where the horse is a little bit, although I'd argue that a young horse with a sway back, there's potentially an underlying rib issue, you know, and so they're kind of stuck in that position, like there's a thoracic restriction, fracture, something like that, that's not been able to be diagnosed, and then it's led to that posture staying that way. However, often you will see, you know, the mare is a bit swayed back, the foal's a bit swayed back.
But I
So
suppose just to say in this instance, what we were talking about at the beginning of this is being able to see that in your horses and understanding what are the things that my horse needs support with. What are things that I can do to work with their limitations or their, you know, what they're predisposed to support them, rather than just accepting a fate, say, as being, you know, my horse got kissing spines because they, you know, they was entirely genetic, let's say, for their conformation. What can we do to support the individual horse to be the most functional that they can be?
yeah, definitely. And that goes to, like, we talk a lot about in posture the thoracic sling and its position between, so the rib cage position between the front legs. And we can have quite an influence on that with postural work, because obviously the front legs aren't connected by bone to the body. The neck position can be a bit of both, like it can be conformational or postural. You know, like they could have a high set neck that comes in above the shoulder joint. And I think also we didn't touch on it probably enough with conformation, but there are certain measurements that are desirable for optimal conformation. So certain ratios in the body that would set you up for a more desirable conformation. So it might be, you know, the relative length of the neck compared to, you know, the length of the back, or the wither to the shoulder, those sorts of things. So there's relative ratios that you look for in a balanced conformation, and also relative positions of things. So such as the neck position relative to the shoulder joint. So if we have a nice neck position, it'll come in just around the shoulder joint, as opposed to a high set neck, a low set neck. Then that could be conformational, or you see like the bigger breeds with what we call like a bull neck, you know, where the neck's really thickened. Like that's part of the draft breeds, for example. But we can influence neck shape quite a lot, and sometimes neck position too, if we influence it at a younger age, as I suggested, you know, with jelly, how I've seen it change over time. And then tail position. The last one I just want to touch on, and then we'll move on how you can observe conformation in posture, is flexural deformities, and even valgus and varus deformities in foals. So, you know, we often think of valgus and varus as conformation. So when the forelimbs are turned out or turned in, and it can be. So it can be that the way the bone attaches to the carpus or the fetlock is actually not straight. But it could also be related to what's going on in the upper body. For example, in a flexural deformity, where you might then end up with much more upright, the conformation may then end up being much more upright. If there's a problem in the rib cage, the pectoral muscles lay over the flexor muscles, which go down to your flexor tendons. And so if there's a problem up higher there, then that could be influencing those tendons in the way they're pulling on the feet. The same with valgus and varus. Sometimes it's coming from higher up. You know, again, the shoulder rotation relative to the rib cage, or the scapular positioning relative to the rib cage. And we can really have a impact. Like I've seen a lot of valgus and varus issues alter with a couple of bodywork sessions in young foals, and a little bit of helping hoof balance too. So yeah, it's really looking at your horse and thinking, okay, like conformational postural. The other one, just to add in, we're going to talk about this, is the roach. So I remember a client bought a horse. Sorry, talking a lot. The client bought a horse. The vet passed the vet check, and the vet said the roach was conformational. In my opinion, roach back is generally not conformational. I have seen foals come out where there are curved through the lumbar, but to me, there is a dysfunction there that we need to address. That's birth-related trauma, which is, yes, going to potentially become conformational, but I've also seen young horses get a roach from trauma. So to me, when there's a roach, there's an underlying issue, which we'll talk about in another episode. So if people want to be able to observe posture and conformation, what are some ways that they could do that?
So when you are trying to differentiate between the two, something that can really help you with your conformation assessment is one, there are, as you were saying, there are conformation guidelines for ratios or lengths, bone lengths that are available online. People can look for those and you can become skilled or, start understanding the bony landmarks within the body. So the bony landmarks can tell you about the bone position, the bone length, and the bone angle. So that one thing to refer to might be, looking at the back and being able to find the bony landmarks of the sacral tuberosities, and then look at the sacrum and look for the tuber cocci and the tuber ischii, which are the points of the pelvis. And then you're looking at a relationship between them and the ratio between them as well. So some common ratios that you might look for include the head length to the neck length. It might include the upper neck to the lower neck. So looking at the bottom side of the neck from the bottom of the jaw to the neck sternum junction, as opposed to over the top of the neck between the ears and the wither. And they're also comparing the back length compared to the belly length, and also, whether they are symmetrical. You might also be looking at muscle development when you're considering your posture. Also your conformation, where in my young horse were they, conformation wise, what are they predisposed towards, I suppose. So, where, you're going to see young quarter horse foals with a huge hind end, and quite wide shoulders, a really broad back, whereas a finer boned foal is going to look very different, in their development, predisposed wise. So, and then in the older horse, you might be looking at their muscle development as we're talking about muscle balance between groups of muscles, say the hamstrings and the quads of the hind limb, and symmetrically, left side to right side. What other things are you thinking about observing?
Yeah, I think just the body alignment and the balance of the body. So, for example, you do get horses that during growth stages will be like high behind, or so there's a relative difference between the height of the wither and the height of the rump. But then you get some breeds, like, I feel like we're picking on quarter horses, but where like they can often be different in their wither height and their hind end height, and that may have become conformation for them. So we can look at things like that, and their relative, like that balance, and also just looking for how your horse does move in terms of their posture, like, do they fix in a position? Do they have changeability in their posture in motion? And how does that kind of translate, standing posture versus, and even conformation, like what the conformation is relative to what movement that they're able to offer you, because sometimes it doesn't match as well. So I think in terms of the takeaway messages for today, I think it's important that you understand what is conformation and what is posture in your horse, or you try to understand, so that you can help to optimize that function and also the longevity and well-being of your horse, because you're then able to set them up appropriately in what you're asking them to do. So you want to ask that question, like, can the horse physically do the work that you're asking them to do? Like, are they designed for jumping or dressage, or is it an extra effort, like they're lacking efficiency in that? What else would you say in terms of a takeaway message?
For me, it would be that, none of this is a dead end. It's not, if you thought something was conformational that wasn't ideal, and you realize it's actually postural and it's not ideal, it's not that, that's a dead end for your horse. We commonly see people in the functional posture course where they've had a horse who, first they didn't know that there may have been an issue or relationship between posture and some functional issues they have. And then when they see it, they realize, oh, it's not conformational, it's postural. And then you go from seeing that it's postural, and then you go, okay, where can I change this? How can I improve it and move forward with that? So it's a bit of a journey coming through that, but just to know that just about everything can be improved and at all ages. I know you've recently talked about an older standardbred in a clinic that brightened up and had a lot of room for improvement and change. A nearly 30-year-old, young horses, older horses, postural conformation, there's so much that can be done, and understanding your horse, their posture, their conformation, it just gives you a lot of power to make positive change, which is the whole point. You have this conversation.
Definitely, and how we can just help them utilize what they have for better. Yeah, definitely. Great. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and watch out for the next Equine Functional Posture course. Find the links find the links to our socials in the comments. And thank you.
We'll see you in the next exciting episode.